Test, test, test. How's it sound? 1, 2, 3, 4, 5, 6, 7.
Good afternoon. Thanks for joining us for our weekly briefing. Before we dive into the ongoing response to COVID-19, I want to share a couple of other updates. I want to start off with good news. Earlier today, we released information on the number of counties that are designated as distressed in our state. Those number of distressed counties have dropped from 15 to 11, according to the Appalachian Regional Commission. So in spite of the current economic challenges that we face, this is good news for the long-term direction of Tennessee's economy. It's especially good news for rural Tennessee's economy. McNairy, Jackson, Fentress, and Morgan counties are no longer considered distressed. That's good news. As you've heard me say many times, what happens in rural Tennessee matters to every Tennessean, and what's happened in the reduction of distressed counties is good news, especially for rural Tennessee. Additionally, I want to discuss an announcement that we made earlier today. The State Capitol Commission is the body responsible for historical displays in the Capitol. And today we announced that that commission will convene next Thursday, July 9th. It's my expectation that they will vote on whether to move the Nathan Bedford Forrest bust. I'll make a specific proposal for what they'll vote on next week, but I want to acknowledge the importance of the process that we have here in Tennessee. The commission process that is set up by the legislature protects the integrity of historical displays so that any changes are rooted in thoughtful civic discourse. This process is the opposite of the mob rule that unfortunately has been dominating the national headlines around historical displays. I have confidence that our process here in Tennessee with the Capitol Commission will be fair and representative of Tennesseans. As we move into the public health portion of the briefing, I need every Tennessean to pay special attention, especially as we enter the July 4th celebration weekend. COVID-19 has not taken a vacation. In fact, it's still here. Our caseload is climbing. It's very serious. It's exactly why I extended our state of emergency through the end of August. Continuing the state of emergency allows us to continue helpful deregulation and to continue services like telehealth to remain available as well. Our continued state of emergency does not stop efforts that are underway to get our kids back in school this fall, nor does it pause all the work that the districts are doing and they're in the process of completing to make this a reality. We're also working with the TSSAA to ensure that sports can safely resume with football and soccer seasons to move forward as planned. Keeping fans and spectators safe during COVID-19 will pose a challenge that will require parents and coaches and administrators to embrace accommodations that will enable seasons to continue and our student athletes to be safe in the process. We all want to return to normal, but until there's a vaccine, we have to keep our social behaviors in perspective. We're seeing an awful lot of Tennesseans take unnecessary risks, packing into a bar with friends or engaging in activities with large volumes of people and with a lack of social distancing. I'm seeing our COVID-19 cases climb. Today we have more than 1,800 newly reported cases, and that's a record high. And the growth in cases isn't limited to our densely populated urban areas. I'm very concerned about the number of cases that we're seeing in counties outside of our urban areas like Sevier County and Macon County and Bradley County and Rutherford County and many others. If you're a resident of one of these counties or any county in Tennessee, I encourage you to make time this week to get a test at your local health department and to stay home whenever possible. Don't put our state 2 steps backward by refusing to wear a mask or refusing to social distance or refusing to pay attention to something as simple as washing your hands. Happy hour with friends doesn't have to mean that you pack into a bar. You can support local establishments with to-go dine-out orders or to-go drink orders. This recent executive order continues to allow that to happen. We've made great strides in Tennessee to get our economy back on track and to help thousands of unemployed Tennesseans get back to work. Those responsible behaviors that we've engaged in have also allowed families to begin safely seeing their loved ones in long-term care facilities. This all-hands-on-deck approach that we've taken in Tennessee is also paving the way for us to get students back to school and to hopefully get us to a place where we can even do things like enjoy live sports, maybe a Neyland Stadium. But we were successful in those efforts this spring, and I'm asking every Tennessean, once again, to continue in their efforts to get us back on track, especially by wearing a mask or a face covering. I wear a mask every day as a simple courtesy, a way for me to serve my neighbor, to protect my family and my friends, and also to help our economy build greater consumer confidence, which is incredibly important for our economy to continue to stay on track. Mask mandates are something that's a hot topic, talked a lot about, especially as the clinical understanding of COVID-19 is showing that face coverings are one of the more effective tools in spreading the virus. Our densely populated urban areas continue to have the high case rates, but local governments in other areas are also asking for ways to create stronger expectations around wearing masks, and we're exploring the most effective way to make this possible. To check the authority of implementing mask requirements is needed in those communities with the highest level of cases. We'll have a resolution on that question hopefully very soon. As we continue our state of emergency and evaluate steps that need to be taken to responsibly address climbing caseload, I signed an executive order today providing additional protections to healthcare workers. Executive Order 53 grants limited liability protection to healthcare providers. Hospitals, nursing homes, healthcare workers are on the front lines of the COVID-19 effort every single day. And this order provides limited liability with respect to the services they render that are not considered gross negligence or willful misconduct. The law only allows us to take this action for healthcare providers, so any other liability issues will have to be taken up by the General Assembly. And we do understand there's an urgent need to address liability for businesses and nonprofits and schools. I plan to call a special session for this, and we'll have more to say as legislative conversations around that special session continue. Before we move to questions, I'd like to ask Dr. Piercy to come up and give a health report, please. Dr. Piercy.
Thank you, Governor. Good afternoon. As the Governor mentioned, we've seen a substantial increase in numbers of positive cases over the last few weeks. While testing rates have also seen improvements, the growth in new cases cannot be attributed to more testing alone. We have a growing problem in Tennessee, not only in our metro areas, but in our rural areas as well. In addition to continued increases in Memphis and Nashville, we're seeing a drastic rise in cases in the Knoxville metro area. Likewise, multiple rural counties are experiencing significantly higher case counts, including Sevier County, Rutherford County, Macon County, and Bradley County. As mentioned last week, now at least half of all cases are from an unknown source, what we call community transmission. This indicates that people are much more likely than they were in the past to acquire the infection when they're out and about trying to, quote, get back to normal. Please listen carefully. This is not the time to get back to normal. We're all experiencing what we call quarantine fatigue, but I can guarantee you this virus is not getting tired. We cannot let our guards down. Instead, we must double down on our efforts to reflatten the curve. If you don't have to go out, stay at home. If you can work or even socialize remotely, I strongly encourage you to do so. And when taking care of those essential services, please wear a face covering and keep your distance while you're out. Speaking of face coverings, as the Governor mentioned, let me remind you of the importance and effectiveness of wearing them when you're in public. Face coverings are one of the single most effective tools that we have to combat the spread of the virus. And when combined with distancing and frequent hand washing, we can halt or even reverse the trends of COVID-19 growth in Tennessee before our situation becomes even more dire. Switching gears a bit to our preparedness efforts, as you know, a primary concern of ours during this entire response has been hospital capacity. As case counts continue to grow across Tennessee, there has also been a commensurate increase in number of hospitalizations statewide. Just like case numbers in general, our metro area hospitals are continuing to see higher rates of patients admitted for COVID-19, especially in Memphis, Nashville, and now Knoxville. While hospital capacity in all of these metro areas continues to remain relatively stable, we're closely monitoring hospital resources, and we're in daily communication with our hospital partners. We have a robust plan for implementation of a stepwise approach, including activation of in-hospital surge plans, as well as use of alternative care sites if the need becomes truly emergent. Finally, as we approach the very happy time of the 4th of July holiday celebration, I want to leave you with a few tips to make sure that those celebrations and any travel that you may be planning to do remain safe. First, staying home is always the safest way to protect yourself and others from getting sick. And if you're already sick or not feeling well, please strongly consider canceling your plans. For those who do plan to travel, remember these best practices. Before you leave, learn ahead of time about any requirements or restrictions in the areas that you plan to visit. Just like you would at home, use a face covering, keep your distance, and wash your hands often, and pay special attention to those measures if you plan to be in any closed common spaces like airplanes or taxis. Avoid large group gatherings and especially limit contact with older persons or people with medical conditions. And if you do plan to visit any older relatives or friends or those at high risk, please get tested before you go. When you return, have a very low threshold for getting tested if you were in one of those large groups, or if you came into contact with anyone who has subsequently tested positive, or if you feel sick during or after your travel. There's very detailed guidance for travelers on the CDC website, as well as additional information on the Tennessee Department of Health website, both regarding traveling and testing. I'll remind you of our website. It's tn.gov/health, and I encourage you to go there for additional information. Thank you.
Thank you, Dr. Piercy. We've talked a lot of challenging issues health-wise today, but I'd be remiss if I didn't end my comments and acknowledging the upcoming 4th of July holiday. Since our nation's founding, there have certainly been years where uncertainty overshadowed optimism. There's no doubt that 2020 has felt a lot like that this year, but America has always been in the midst of a crucible. Our trials reveal our perseverance, and they unearth our character and they build our hope. And that's what I'll be celebrating this 4th of July, the hope that's core to this country and the hope that is yet to come. I invite you to join me in reflecting on that as we celebrate the greatest nation on the earth this weekend. Be happy to take your questions. And know that we have General Holmes, Patrick Sheehan is here from TEMA, other members of Unified Command, but happy to take your questions. Okay, yep. On what? Well, we're working the TSSAA to develop those guidelines. Is there a chance that you would maybe move that date back to the end of July instead of the end of August? Well, we're just in, I can't answer that. We're just in the middle, just in the beginning, really, of developing the specific guidelines for contact sports.
And you said a few minutes ago that you do plan on calling a special session to the legislature to take up liability for these other entities that aren't covered under the executive order. When do you think that would happen?
Well, that'll be up that'll be up to the conversations that we're going to have in the next week or so. I expect there to be a special session, but we're in conversation now, so we don't have a date yet. Don't know when that will be exactly. I expect that we'll have a special session, yeah.
So I had a question about it looks like a major surge in testing. If I'm looking at this right, there was maybe 24,000 tests in the last 24 hours, something like that. Can you explain what that is?
Sure. It's actually twofold. And you have to keep in mind that there are lots of dates in this timeline. So, for example, someone gets sick, and there might be a day or two, and then they go get tested, and then there is some amount of time for labs to process those tests. Admittedly, lab turnaround times are starting to get bogged down a little bit just from the sheer volume. We're working every day to bring more labs online, as well as to enhance the capacity of labs that already exist throughout the state. And quite frankly, we have a very large number of high-performing labs, and that's allowed us to do lots more tests. So today we did result almost 25,000 tests, which is by far the highest ever in a single day. Part of that is increased demand. As you very well know, demand here in Nashville for getting testing has gone up, and we've seen that around the state as well. That also represents somewhat of a clearing of the continued backlog into the system. You'll remember that we had the system unplanned shutdown on Sunday, and that is because that system is not built to handle tens of thousands of tests per day. So some of those are from a few days ago, and we're catching that backlog up. One more point to remember, the patients that were tested, even if it was a delay in reporting into our system, they've already been notified. It wasn't a delay in them getting their results, it's just reporting to the state. So lots of factors at play there, but we are seeing our testing grow day over day.
And you mentioned there are surge plans for within hospitals and for other locations. How far away from that are we in any of the major metros?
Yeah, so in Memphis and Nashville specifically, we have not yet had to activate in-hospital surge plans. Specifically in Memphis, it's something that our eyebrows are raised at. We're watching it. We're not there yet. It has leveled off a little bit in the last few days, and so we want to take care of those patients in the hospital. That's the best setting anytime we can, and so we still have lots of levers to pull, but we're watching it daily. Thanks.
Governor, you said you expect the Capitol Commission to vote whether or not to remove the busted forest. Is that your position, that you think it should be moved, or have you taken a position or come to a conclusion yet?
Yeah.
Or will you? And secondly, this is happening, would happen, I think, before you would act on the bill to add two legislative appointments to that panel. I wanted to get your thoughts on why you thought you should do that beforehand rather than let those two appointments come on.
Yeah, the decision about what to do with the bus will be the Capitol Commission's decisions. I will make comments to that commission next week, but and with regard to the bill, I haven't received that bill on my desk yet, so the decision for timing of whether or not to sign that I haven't made that decision. I haven't seen the bill yet.
Have you thought of whether that panel needs two more people? It seems like you're moving ahead without the
Well, we haven't made that decision yet because we haven't gotten the amendment to the bill yet.
Sergio, thank you, Governor, for talking with us today. I have one question for you, one question for Commissioner Piercy. The first one, you talked about a resolution regarding a mask mandate for those counties that have more people. Can you talk a little bit about?
So there have been requests by localities about whether or not the authority exists for them to have a mask mandate, and we're researching that right now through it's a legal question, and authority will determine that authority and have a resolution to that in the next few days.
Are you considering issuing a statewide mandate? Is that something you're?
Yeah, our approach is really targeted at where there are requests and challenges. That's the direction I'm headed.
And Commissioner Piercy, you said something a few minutes ago. Pretty strong. You said this is not the time to go back to normal. Yet cities are moving
Yeah, you know, the tricky part here is we have to learn to live with this. The governor mentioned vaccine and herd immunity go hand in hand. And until we have that vaccine available, or until about 70+% of the population is infected, and trust me, we don't ever want to get there, then we have to learn to live with this virus. And you've heard me, as well as the governor, explain multiple times this tension that we have to balance between health and the economy. And you've also heard me say that individual economic prosperity is an integral part of health. So we have to find a way to balance the two. And when I said we shouldn't go back to normal, you've seen pictures of people crowded into spaces, whether it be graduations or bars or things, and it looks exactly like it would have looked a year ago. That's what we can't go back to normal. We have to make these modifications, and some of them are inconvenient. Nobody likes wearing a mask, particularly in the summertime. But as the governor mentioned, it's a way we can show that we care about our neighbors and doing it for the good of the public to make sure that virus rates stay low and we can keep our economy open.
So I'm wondering, without any enforcement or any punishment to these places or to these bodies who want to go back to normal, I mean, how can we do it? How can we make that balancing act?
Yeah, that's the $64,000 question. As the governor mentioned, we don't think that there's a one-size-fits-all, but we do want to be able to allow for those restrictions or additional enhancements to the policies in certain areas that are interested in doing that. I know you would agree that not every county is in the same position, both economically, societally, and not with the virus either. And so we want to be able to allow those flexibilities whenever they are interested in doing those. Thank you.
Governor, have you considered a travel restriction at all? I know that New York is not, people coming to Tennessee. Have you considered that?
I have not. I have not considered travel restriction.
I have a question for both of you as well, Governor. Have you gotten guidance, because you talked about a hotspot strategy, I think it was maybe last week for the first time. What is the guidance that you've gotten so far about your ability to tailor a mandate or a policy proposal to a certain area? I mean, is that something that you can tinker with? I mean, like following up to what Sergio asked, it seemed like you were still getting guidance, but I didn't know if you received like the legal definition of that.
Well, you ask about guidance. What we're doing is developing a strategy for areas that have a particular challenge, where we have a county that has significantly increasing cases. We're in a meeting this afternoon, our health department and members of Unified Command, meeting with local officials of a county to talk about testing strategy, contact tracing strategies in that county, communication, how we do public service announcements around face coverings. So it's to develop a strategy for those places that have a unique challenge going on. That's our hotspot strategy.
Dr. Cruz, your follow-up to that would be, I'm searching for some larger context here, because time is so valuable in this because there's so many people working today. So we have more cases now, but can you compare our ability to handle that as opposed to, let's just say, May 1st, in the height of the lockdown?
Are you speaking about hospital capacity?
I'm just talking about our ability to handle a higher case volume and where we're at now compared to how we would have handled it 2 months ago. Because people look at these larger case numbers, and I think that they are searching for a larger context. Is the state just so much better prepared now to handle that? Will be okay? Or how do you put us on that spectrum? Because it felt like some of your language today was maybe the strongest you've used.
Yeah, I mean, you're very astute in picking up. I'm serious about what I said today, because the key message here is not chasing after hotspots. We find hotspots, and there is, as you mentioned, a robust plan to go and increase testing, improve messaging, engage community leaders, locate vulnerable populations when we have that hotspot. But that's too late. When we get to that, it's too late. We have to take a step back and focus on primary prevention. And primary prevention keeps people from getting it in the first place. So I know people get tired of hearing us say it. Wear the face covering, wash your hands, keep your distance. We know, and I'm sure you've seen it come out recently, almost all of the spread is person to person. Common services, yeah, it can still live there, but the main way people get it is by close contact with others. And so if we take those primary prevention messages of keeping your face covered and keeping your distance from others, that's how we not only target the areas, but prevent them in the first place.
So do we need more contact tracers now since it's getting harder and harder to tell where these people are interacting?
Sure. So contact tracing, as soon as case number grows, the need for contact tracers grow. And we've seen quite a bit of rise in cases. We're going to need more contact tracers. We have now brought on, in addition to what we already have, we've brought on 2 contract agencies and have finished training the first group of those, are in process of training the second group. I speak with my counterparts across the South as well as the nation, and everybody is in this same boat. We're hiring contact tracers as fast as we can and just trying to keep up with the load as best we can. At some point, it's going to become very difficult because we added 1,800 new cases today. That's 1,800 new case investigations that we need to be doing tomorrow.
Yes, Governor. So previously you mentioned that your office is exploring the feasibility of a statewide mask mandate. But before you come to that decision and your office comes to that decision, would you be opposed to a county or city government instituting such a mandate itself, similar to what St. Louis County has done in Missouri?
Yeah, so that's actually what I said, was that my approach is more targeted to, and this comes as local counties request clarity on the authority that they have to put in place stricter mask standards. So that is actually the direction we're looking at.
Okay, so are you ruling out a statewide?
Well, it's just not it's not what we're not considering that right now.
Yes, on the orders you made Wednesday, dealing with the extending the state of emergency. I've heard some people mention that you can go get a hamburger almost anywhere you want as long as you have social distancing, but it's still really difficult to go to a public meeting because you allow the local governments to continue to have their electronic and virtual meetings. And some people are complaining that this gives local governments an excuse not to have public meetings and find ways to let people attend. What's your response to that?
Yeah, great number of requests from municipalities and local governments who, some of them have a difficult possibility, almost a virtual impossibility, given their the locations of their meeting places, whatnot, to have local meetings. So we want them to continue to meet. Many of them are elderly, don't want to be put in that position. It requires them to not have a choice. You have a choice of going to get a hamburger. If you're a county commissioner, you don't have a choice of whether or not to go to a county commission meeting. And so we are trying to provide for government meetings to continue, but to provide for safety for those meetings that have to be held.
And on the CARES Act money that you all were discussing this morning, I guess almost $1 billion of it is targeted for unemployment, and then there's several of them that have money going towards small business relief. How much of that money has been used for combating the virus itself, and how much more is going to go toward combating the virus?
Yeah, I can't, as you've seen, there's dozens of categories for spending. I don't know how much, I can't recall off from memory the numbers associated with direct COVID spending. For example, there's spending related to testing and facilities, and there are a number of categories. And again, we don't know what the future holds for this virus over the next 6 months, but we're preparing for that. We're allocating spending reserves for what we believe will happen for spending. It's public, it was detailed, you can see all of those numbers, they're available. And I would encourage you to look at that document. It details specifically where all the money's being spent.
Chris, last question.
Two, if I may. With all these rising numbers and what we've heard today about the inability of a lot of people to, or choosing not to wear masks, how worried should Tennesseans be?
How worried should Tennesseans be? They should be very concerned. I mean, the entire country should be concerned, and it is concerned. But we have a significant public health crisis. It is present. There are people dying every day in our state. We lose Tennesseans every day to COVID-19. It's transmitted by person-to-person contact. Anyone can get it. We should be very concerned. When we have people dying in this state as a result of this virus, we should be worried about it. We should be concerned about it. We should be taking steps. We should take personal responsibility for this. We've watched caseloads climb. What I think we need to remember is that we have mitigated this before with behavior. We can mitigate it again with behavior. As Dr. Piercy said, the virus is with us. And we have to learn to live with it and to live our lives, but understanding that it's there. But I don't think we should be afraid of it. I think we should just take the appropriate steps. You know, if you're wearing a face covering and you're washing your hands and you're staying socially distanced and you're doing the things to keep yourself safe, then you shouldn't be worried about your own personal or the people around you as a result of your activity. That's what I would say to folks.
And on I think you said you'll be addressing the Capitol Commission next week. Can you tell us what you'll say in your comments?
Now, I haven't prepared those yet, so I can't. I'll have more to say about that next week.
Did you say you would be taking a position on what they should do?
I didn't say that, but I'll just be addressing the commission. I'll have more to say about it next week. Thank you. I appreciate it. We are in a critical time. We're in a remarkable time. We're in a time for great celebration, even this weekend, in the midst of the challenges we have, because we have great deal of hope. And I have a great deal of hope that Tennesseans can rise up and meet the challenges that we face, and that we will be better off as a result of it when we're done. But it'll take the continued engagement, as I've said for months now. We need every Tennessean to take personal responsibility, protect themselves, protect their neighbors, protect their families, to serve one another. And I encourage all to do that, even as we enter into this holiday season where we celebrate the greatest nation on earth. Thank you for being here.